Good afternoon. Today I'm going to tell you a little bit about a project that was funded by the North Carolina Collaboratory in the context of developing wastewater-based surveillance for the state of North Carolina. This project was funded in collaboration with multiple entities across the state, including universities in the UNC system, as well as North Carolina DHHS and North Carolina DEQ. We actually started this project as early as the beginning of March of 2020, when we recognized that there was a need for the development of wastewater-based surveillance to assist the decision-making strategies that were being developed simultaneously in the context of clinical care and public health. When we talk about wastewater-based surveillance, we talk about the use of a system that relies on an aggregate measure of a community's wastewater, as depicted on the right. In any given case, a centralized wastewater system, known as a sewage treatment plant, is the recipient of a town, city, or entity their wastewater contributions. The size of our wastewater utilities that we are working with across the state of North Carolina ranges from 4,000 people to roughly 550,000 people. In the context of wastewater-based surveillance, we can use time-weighted and flow-weighted samples to simply give us an estimate of a day's worth of wastewater in the context of the COVID-19 concentration. Those loading estimates of COVID-19 in a wastewater sample from a utility allow us then to examine trends in virus concentrations and also trends in other markers related to SARS-CoV-2, such as variants or variants of concern, and allow us to examine these trends in the context of mitigation and protective strategies that may be put in place in each of those towns. In this way, we can track trends in virus concentration and see if a town is currently experiencing an increase, a decrease, a sustained increase, a sustained decrease, or even a plateau or a drop-off in measurable virus concentration, allowing us to understand a bit about the entire community that is served by that wastewater utility. In addition, by using a set of assumptions, we are able to also estimate community prevalence and estimate the loads of infected individuals, particularly if we work in sub-sewershed areas, such as in hospitals or in specific communities. We can target hotspots using wastewater-based surveillance, such as mobile testing units and vaccine distribution locations, as well as school openings. And we've even seen the ability of wastewater-based surveillance to be utilized for decision-making at such locations as in the UNC system. For example, App State University developed a quite nice dormitory testing program, as did UNC Charlotte and UNC Wilmington over the course of fall of 2020. In the case of our particular project, because time is short for us today, I'm going to be talking a little bit about some key areas of investigation that relate specifically to the biotechnology industry and the ability to generate data quickly for decision making. We are interested in our particular project, particularly in North Carolina, where roughly 40% of the population lives in rural areas, to understand the utility of wastewater-based surveillance, not only in our metropolitan cities and towns, but also in some of these underserved locations and smaller locations. We're interested in streamlining our wastewater-based analysis, and in that case, we're working hard with Biorad and other biotech industry components, and we're interested in reducing the overall cost of the analysis and in potentially including other pathogen threats. This work is being done collaboratively at UNC-Chapel Hill as part of a project that started at the North Carolina Collaboratory, but then subsequently went on to be funded by the NIH RAD-X program to develop a new system. We're interested in reducing lab errors and identifying pinch points for contamination. This is an important component to wastewater-based analysis, and we're building new approaches for decentralized systems, and we're showing the value for combining data between clinical and wastewater-based analyses, particularly for COVID-19 targets and for variants. The North Carolina Pathogen Research Network, as we named it, received $1.8 million from the North Carolina legislature and existed to sample 19 wastewater treatment plants 1 to 2 times per week across 9 counties from June to December 2020. You can see in this figure, and I can provide it to anyone who is interested in another version of this, that we had partner institutions such as UNC-Chapel Hill, North Carolina State University, North Carolina Department of Health and Human Services, East Carolina University, the Institute of Marine Sciences down at the coast where I reside, UNC Wilmington, the North Carolina Department of Environmental Quality, and UNC Charlotte. In the triangles, you can actually see those wastewater treatment plants that were targeted for analysis. Subsequent to our completion of this project, we couldn't have been more excited to partner with our North Carolina DHHS valuable partners, Dr. Virginia Guidry, Dr. Stacy Reckling, Dr. Ariel Christensen, and Dr. Stephen Berkowitz, and participate as part of the CDC National Wastewater Surveillance System. In doing so, we brought North Carolina to the forefront of wastewater-based surveillance, and we have now succeeded in generating reports on the wastewater-based trends for 11 locations throughout North Carolina since the beginning of January 2021. And so we're now into our 4th month of conducting that work. I'd be happy to answer questions about our technical components of our work, and I'd also be happy to answer a bit of questions related to our locations, our wastewater utilities. As you can imagine, we thank our collaborative partners, but we also are wading through the issues related to data sharing and data analysis, and I would be happy to provide any of that information for those of you who are interested in requesting further information. Thank you very much.